The overall goal, I guess long term, is to move towards electronic medical records. We see lots of risk with the current paper-based system, lots of inefficiencies. It's a barrier to good communication to general practitioners and other referrers. Many of our doctors, myself included in private, have abandoned paper records and run our own practice management systems, and we see the advantages of them. But the task for a hospital to implement that is massive compared to an individual practitioner. There are two ways that we could go about this. If we were a public hospital, we might put the process out to tender, choose a provider, and then over a couple of years implement it. We would have a group of doctors who are all employees, and basically it would be their responsibility to learn how to use the system. And we've seen that even when you employ the doctors and you have that management control over them, that it's not an easy task, and at least one of our big public hospitals has seen a number of their doctors rise up in anger at the rollout of a system with a clunky interface in which they saw as slowing down their ability to deliver medicine. So it was clear that to try and go down that path in the private system, and there have been some attempts in the private system elsewhere which have not been greatly successful, we felt that to try and go down that path would be extremely dangerous, high-risk strategy, because while our primary customer is the patient, to a large extent our other group of customers is our doctors. And they choose to come here, they choose to bring their patients here, they choose to base their practices here, and we have to provide them with what they want, not what we want them to have. In discussions with our doctors, it was apparent that the number one priority was to give them the information. So we chose to develop this system incrementally, and starting off by delivering in the simplest possible way the information that doctors wanted, put it into their hands, engage them with the process, hopefully getting them to a point where they not only wanted to use this software, but they were wanting more. And then we would gradually build on that with other functionality in the future, hopefully, such as discharge summaries, medication, e-prescribing, but that we would start off by absolutely giving them what they wanted and what made their lives easier and what made the delivery of care for their patients safer, and that was radiology and laboratory medicine in their hands.